Welcome. This is Professor Pranav Parekh. I'm working in academics since 2008 and I'm going to talk about parental products. Now, what are parental products? So, they are the product basically, they are used apart from intestinal route. Intestinal route essentially known as a gastrointestinal route, which includes oral drug delivery. So basically, in parental preparations, we are bypassing oral route and using any other route for their added advantages. Now, right now in industry, this parental route is being preferred as compared to other dosage forms because of their lucrative their advantages. Now, what is the future of parental product? Is that we all know most of the vaccines we are using by parental routes, and transdermal drug delivery is one of the important criteria. And if you look at the watches, different watches now coming, which are recording your details of your body, and accordingly they are releasing a drug from your skin. So the newer and newer technology needs parental preparation instead of oral route. So it is important to study parental products for getting into the industry. So let's start without wasting much of the time. uh, what are parenterals? uh, we know parental preparations, they are used bypassing the oral route. In the Greek word, para is called as outside or by bypassing, and enteron is called as intestine. Drug which is delivered apart from intestinal route is called as parenteral preparation. Now, as we know, as the definition says, it bypasses gastrointestinal tract. What are the advantages of that? Why we are using parenteral preparations? Advantage is that it is the fastest route of administration, because whatever injection or whatever drug dose that you are punching inside your body is rapidly mixes with the blood, and with the blood flow and circulation it reaches to the site of action very rapidly. So it is the fastest uh, uh, route of drug delivery. Uh, Added advantage is that it is having higher bioavailability. Now, why higher bioavailability? Reason is that whatever drug you are punching inside the body, that all drug is directly getting inserted into the blood. Okay, so bioavailability. So all this drug, 100% of the drug which is inserted, it is getting towards the site of action. So bioavailability is 100%, or we can say very high, uh, because of which we don't want to add any additives like colorant, flavorants, testing material, right? All this sugar and all these things. So it reduces the bulk that is required for the formulation, ultimately reducing the cost of the production. Now, it is useful for non-cooperative and unconscious patient, which means oral route cannot be used for a patient unlike a small child, like 1 year old, 2 year old. He cannot, he don't know how to swallow, and uncooperative people, non-cooperative people who are actually not willing to take the drug because of taste or whatever the reason. So we can go for the uh, punching that dose by parenteral route. Same way, unconscious patient cannot swallow, so we can use this uh, type of route of administration for unconscious patient. So next point, next advantage is that input of drug can be regulated easily. You know, you want to insert the dose of, say, example, 2 ml, but suddenly while punching the dose you came to know that no, the less dose might be enough or might be required. So that time immediately you can stop punching it, so you can regulate the input of the drug so easily, while in case of oral route, if you swallow anything you cannot revert it back so easily. So input of drug can be regulated very easily by using this type of preparation. Now, what are the disadvantages? Every coin have two sides, like advantages are there for this formulation and there are disadvantages. So what are the disadvantages is that pain at the site of entry. You know, We all, when we were child, we used to afraid of injections, the pain that is causing into the muscle. Okay, so that is the big problem for this type of drug formulations. Now, possibility of infection. If that parental preparation is not prepared aseptically, if it is not in the aseptic condition, so what will happen? Outside infection may directly enter into the bloodstream, and that causes the infection, because now there is no skin or no other barrier to stop that infection. That microorganism directly got entry inside your body. So that is one of the big problem. So it should be always be aseptic when you are inserting that dose into the blood directly. Next is, it needs skilled person, and those can be costly. Skilled person is required because you know where to puncture the vein, where to insert that drug, whether it is subcutaneous or intramuscular or intraarticular. So you exactly need to know uh, how much pressure to be applied and everything, right? So you cannot do it yourself, so skilled person is required for that. And those can be costly, which means there is a cost involved in maintaining the sterility of the product, packaging it, then preparing it in a aseptic area, and maintaining that asepticity, and inserting that drug into the body using skilled person. So this all process require cost as compared to the oral route or other route of administration. So it can be costly, but it's worth it. So let's move to the next part, that is, what are the different routes of the parenteral preparations. So if you're punching that dose directly inside the body, then there are different routes. First is subcutaneous, which is very at the upper layer of the skin. Okay, then intramuscular, which is penetrating uh, upper layer of the skin and directly getting entry into the muscles. Next one is intravenous, which means it is getting inserted into skin layer and puncturing that vein and releasing the dose into the vein, means directly blood circulation. And third one is transdermal, where we are applying the patches on our hand, and that patch start releasing the drug slowly, and your skin absorbs that drug, and it gets entered into the site of action or blood. Next one is implantation, which means you insert some material or some patch inside your body, and again tie up your body, which means you're inserting something inside your body which start releasing the drug slowly inside the body. So these are different routes or types that we can uh, see as different types of parenteral routes: subcutaneous, intramuscular, intravenous, transdermal, and implantation. Now, apart from that, there are different minor routes also, like intrathecal, which where we are inserting it into the bone marrow, or inserting into the peritoneal cavity, inserting the drug into